Everybody except Cecilia at this point, we're going to be muting. So we're going to get started. Remind you that this is being recorded and will be posted on YouTube. So you will be famous. Anything you say will be enshrined in history forever. And 40 years from now, people will be talking about whatever you said today. Excuse me. So welcome to I Am. I Am is a presentation of the Maryland Centers for Independent Living. There are 7 Centers for Independent Living throughout the state of Maryland. If you live in Maryland, there's one that serves your area. Centers provide information, referral, independent living skills, and other services throughout the state of Maryland. We are the information hub and resource for people with disabilities. We are organizations operated by people with disabilities. Notice I didn't say owned and operated. Operated by people with disabilities. And we're pleased to be here. If there's ever anything we can do, please make sure you give us a call. Excuse me a second. I'm allergic to something in my basement, which I don't even know what that is. So again, welcome. I want to remind everyone that if you want to sign up for these Zoom meetings, the link changes every week. So please don't try to use last week's link to get into this week's meeting. We have these shows every Monday at 2 o'clock, and usually they run until right around 3. Sometimes they go a little bit over, but usually at least from 2 to 3 or thereabouts. So welcome. I'm today going to introduce Cecilia Warren. Cecilia is Director of Emergency Preparedness for the Maryland Department of Disabilities. Wanted to have her come on today and talk to us about what's going on with emergency preparedness, what's going on with COVID, maybe help us think through our emergency preparedness plans, etc. I know her to be eloquent and interesting and always fascinating. So it's a great opportunity for me to welcome Cecilia Warren today. Cecilia, welcome.
Thank you so much for the kind introduction. I was so pleased to get the invitation and really honored to be here. I want to apologize in advance that my guide dog, Gail, has a new squeaky toy that he's just decided is of great interest to him. So hopefully we won't hear any of that in the background here. So my presentation today is very much about Maryland specific towards emergency preparedness and response. And it also does apply to COVID-19, although also keep in mind that we have modified many of our plans for this hurricane season or tropical weather season to really conform with the guidelines for social distancing and not using congregate care, which normally we would have congregate sheltering for hurricanes. And this is very unusual this year in that we can't do that. So we've had to kind of go back to the drawing board and redefine what mass care will look like should that be needed this summer. Hurricane season will continue on until the beginning of November. Typically in Maryland, we don't usually have severe impacts from hurricanes until mid-August through the end of October. So last year we were very fortunate that we did not have any major impacts from tropical weather. So when we approach emergency preparedness and disaster response, one of the things to keep in mind is that there has been a great deal of litigation in this particular policy area. And we even had litigation that was wrapped up last spring with the DC government, District of Columbia government. And so we always look at these agreements, these settlement agreements and directives that arise from litigation in order to determine, is our program at risk? Do we need to make modifications? Do we need to make other investments? So using the construct of the Rehabilitation Act and the ADA, essential government services such as emergency preparedness and disaster response are required to properly plan for the unique needs of people with disabilities. And the courts have accepted this doctrine, which is known as the right to be rescued. It's a fascinating doctrine, and I think it has been well argued and well developed, and we feel that looking towards that, that emergency response and recovery is an essential government services. So people with disabilities have additional risks during a disaster. And this includes things like the ability to access information and instructions, warnings and announcements, the ability to have participation in mass care or to seek shelter. Another example is the ability to receive proper medical care. And with respect to that, in Maryland, we approach these types of needs under the construct of basically access and functional needs. It's called AFN for short. So the unique challenges for people who have access and functional needs, in particular with COVID-19, has been accessing or receiving medical care, accessing their support services, and also accessing accommodations during this public health emergency. So we know that there are existing needs that have to be considered in disaster response and recovery plans, and also that we as a population can be disproportionately impacted as we have been by the pandemic. In addition, emergency response activities and mitigation also, it may sometimes increase disruptions to accessing care and support. So we approach this from a perspective of inclusive emergency planning, which some people describe this as sort of baked into the cake approach. So that it's not a separate add-on service or a separate add-on plan, but it's integrated throughout a jurisdiction's plan, whether it's the state or a local jurisdiction. And so when considering people with disabilities, we have to take this into consideration in every phase of the planning process. So preparedness, response, recovery, mitigation. And past emergencies has exposed some of the inequities in emergency response for people with disabilities. There is an overall tendency to underplan for the disability community for periods of disaster. And oftentimes people feel that could be due to a general misunderstanding of what our unique needs are. And emergency management teams who do planning, we often encourage them to consult and get input from people who have disabilities and really gives them a different perspective. So some of the issues that we have determined that have the greatest impact on disabilities include notification of an emergency, evacuation, emergency transportation, sheltering, access to medications, refrigeration, backup power, also access to mobility devices while in transit or at shelters, and of course, access to information. So many states have developed toolkits to help guide emergency planners with the disaster planning and to help make it inclusive. Maryland does have a disaster toolkit. I believe I sent it out electronically on our previous talk several months ago, but if anybody would like additional copies electronically or in print or in large print, please send me an email and I'd be happy to send it to you. Also, I believe we have a link on our website. For MDOD's website, we have a link to the toolkit. So in Maryland, we use a function-based framework for disaster planning, and the functional areas are communication, medical and health, maintaining independence, supports, and transportation. So I'll give you some examples of what we do to accommodate and plan for communication needs and what can be done to meet those needs. All of these things are also included in our toolkit. So under communication, it's not just a matter of communication in terms of interoperable technology, although that is one part of it. We also have found that embedding a disability policy expert, communication expert in the Joint Information Center is very helpful. The Joint Information Center has an acronym of the JIC, J-I-C. And the JIC is where a lot of the media people, the media staff, not the newscasters, but media staff for various agencies, and the digital content experts work together in essentially one room, of which all types of media inquiries and FAQs and things like that are drafted. And so it's a real nexus for information. And by having our communications expert embedded with the JIC, they really have been able to provide more efficient and effective coordination to disseminate messages to people with disabilities, including people who are deaf and hard of hearing or blind and low vision. They can also provide best practices on adhering to the WCAG guidelines to ensure that web-based communications are accessible, and also give advice on providing captioning and ensure that videos that are generated for the disaster include captioning. We also do this to ensure that messages provided in formats that are accessible to the audience and also diversified to the audience. So it's not simply just captions, braille, but also language appropriate materials and in plain language. And so when we look at language appropriate materials in this current disaster, we've really had to look at a number of languages that were needed to reach our audiences in Maryland, especially in certain industries where there was a prevalence of a specific language other than English. At MDOD, we also have established what I would consider our constituent services hotline, and many of you would know Nan. She staffs that hotline. And also, we increase our staffing and the monitoring of the hotline on evenings and weekends during an activation. So currently, we're under a public health emergency declaration. So we have longer hours and more attention, sort of a enhanced attention being given to issues coming in on the hotline. Currently, I would summarize the issues we're hearing most frequently on our hotline is people with disabilities who have requested access to support persons in the hospital, support persons to be bedside in hospitals that either are unaware of the requirement of the order, the secretary's order, or perhaps have not figured out how to implement that policy. So we are frequently in touch with various hospitals that we've received complaints from constituents who are inpatient there and are requesting bedside support people. And so, yes.
Cecilia, just to refresh everybody's memory, could you tell everybody what that order says?
Okay, so that order, which was signed on May the 9th or 10th, I believe, by Secretary of Health and Secretary of Disabilities, states that all hospitals in Maryland must develop policies to allow individuals with disabilities to have support persons bedside as of May 22nd. And so those policies, although they may have been drafted, did not appear to be socialized to the frontline staff. And we had several individuals who were requesting support persons, such as family members, support staff, and were encountering really an unreasonable level of restriction, or hospitals that were unfamiliar with what the policy said. Once we could reach the correct person who were implementing the policy, we've been able to resolve every single complaint. But unfortunately,
these are for non-COVID related hospital visits, right?
We do not specify whether it's for COVID or non-COVID. Okay. It can be for, we don't specify either way, but the policy does include, and the guidance we provided does include that it does require COVID-19 screening for the support persons, and they do have to take COVID protection. So whether or not the patient has COVID is immaterial to that. The support person must agree to properly don the PPE and conserve PPE. so that essentially it would be as if you were visiting someone with COVID-19, because you do have to mask up, wear the gown, gloves, whatever protection the hospital deems necessary.
Great.
So, and if you need copies of that, that's another thing I'd be happy to send along also. In addition to that, let me see, where did I leave off here? Okay, so that's one issue on the constituent hotline. And some other issues have included things like access to food, access to testing, difficulty in getting test results returned, kind of things that, that we would expect. So along those lines with communication supports, of course, in this particular emergency, we need communication support at drive-through or walk-up testing sites. So we have a contract to provide, we have a vendor who is providing remote video interpreters, and we also have various screen magnifiers and other systems to help people who cannot use just regular either printed English, or they need a translation to another language. So there's a lot of that sort of back end work that goes into ensuring that communication is available so that everyone can be an equal communication partner. Now, I would be remiss if I did not also mention that the technology component is huge, and this is why we are so appreciative of Maryland TAP, the Technology Assistance Program, and of course in our relay services in addition, and all of the technology that sort of is the infrastructure behind that. So they've played a huge role in this, in ensuring that communication needs are met. So moving on, for health and medical needs for disaster response and recovery, this really comes down to a lot of sort of interdepartmental work through not just the Health Department and Human Services, but also a number of other groups. And so this particular area has brought us to probably the most change in this environment for sheltering during a disaster. Currently, we cannot do congregate sheltering, which typically, if the state were to open a shelter, like an evacuation shelter, a hurricane shelter, this would normally be like in a large facility, such as a college gym or auditorium. We have these facilities that we inspect annually. We have them throughout the state. And it's quite an operation to open one, of course, and we would pre-place all types of inventory and supplies in advance of the disaster. If it's a notice event, meaning we've had some warning, like a few days to prepare. But because of the mandate to not have, to not have groups and to remain 6 feet apart, this year, if we have a need for this, it will have to be in a hotel or in some arrangement to allow for isolation of people to maintain distance. And so this really kind of changes the complexion of how resource intensive this could be. But also consider that we would have to be doing COVID-19 monitoring during any type of sheltering event. So that also means we would need a greater, I guess you would say, we would have greater needs for health and medical staff to support that. When people come to a shelter, they may come without medicine, without essential supplies that they need to maintain their health. So those are things that have to be taken care of in quick fashion, rapid order. So in another part of this has been, which has been a positive, is there's been an expansion of telehealth services. So this has really been welcome by almost everyone. But on the other side of this, that increases the need for technology. So again, we're back to talking about all the support that Maryland Technology Assistance Program provides for individuals who may not have, may be temporarily without technology or need to try it out and borrow technology on a temporary loan. So another thing that we work with the Department of Health when needed, and that was done early in this disaster, was extending prescription refills and also allowing for delivery for people who were not previously receiving delivery. So we try to maximize the availability of extended prescription refills and delivery services for individuals who are really at high risk due to their health conditions. So the next category here is helping people to maintain their independence needs. And so along those lines, some people can be very independent. As we know, there are people, even within one specific disability, there's a lot of variation in how much independence one has. And with certain supports or tools, a person can be completely independent. I think, as most of you know, I am blind and use a guide dog, which allows me to be very independent. But if something happens to my guide dog and I don't have a white cane, we are in a very different situation then. So I use that as an example of, really a disaster can sort of upend the situation for somebody, and someone who was previously independent may suddenly need a lot of support. So along those lines, we have expanded our services of community feeding operations, working with Department of Human Services. I know I spoke about this issue early on, and this was a concern of the SILs, and this is also a concern in every disaster, is for feeding, especially as people have difficulty with income or have sudden unemployment. So currently we do have a temporary program for food delivery, which can be accessed through 211. And if you want additional information on that, I'd be happy to also send that information to you. There are also oftentimes transportation issues, which, when paratransit operations have to be reduced or limited, that is always a concern that we try to plan for. If we have to do an evacuation at a certain area, like, for example, the Lower Eastern Shore, we would have to most likely provide MTA buses and have an organized evacuation process. I'm just using that as an example. That is not something that's currently, going on or under discussion whatsoever. So also temporary accessible housing options. This is something that, as I mentioned, it's under great discussion because of the limited ability to provide mass care. In this particular situation with hurricanes, we would have to be ensuring that people who had mobility needs would have accessible hotel rooms. And along those lines, we do anticipate there may be a wave of people needing support at the end of July if eviction protections expire, as are currently projected. So the next area is personal care assistance needs. And so we often work with other agencies to adjust sort of workforce policies to allow for expanded services if somebody needs to have personal care assistance or other type of support. In this particular disaster, you may recall that direct support professionals were designated as essential workers. I will say that we are really fortunate in Maryland that we have Secretary Beatty, who is very much an advocate for ensuring that supports are made available and that independence can be maintained. And she worked, she's worked hard with all of our stakeholders. Along those lines, we always have to remind people that we must be able to provide access to mobility aids, including service animals. Sometimes we do run into situations where different entities want to put up the big no service sign when they see a service animal coming through the door. And so we also work with the business community. This particular disaster, you may recall that we worked with our private sector partners to ensure that group home service providers could purchase groceries and essential supplies in amounts above the store-imposed limits. So that was something that we received help from. We received assistance from the private sector director at Maryland Emergency Management Agency, and also I think the health department was very appreciative of this. And certainly we were. You can imagine if you're operating a group home, and when you go to your local retail grocery store and are only permitted to get 1 dozen eggs, and you may be caring for several people, that doesn't go very far. And so it was very food, the ability to get a proper amount of food and supplies in one trip was very important. And so we were able to secure a letter and an arrangement for group home service providers. And so, we're appreciative to all our stakeholders for that. And the last item here regarding transportation. Transportation, I think, has always been and may always be a challenge when it comes to disaster response and recovery. We have, I don't know that anyone has sort of solved this issue, even though we do have more options now than we did before. It's definitely a challenge, and so we have to work with our local jurisdictions, especially in areas that don't have paratransit or perhaps don't even have fixed route services. Much of Maryland does not have public transit, and so sometimes it takes us to being creative in order to, make a transportation plan if needed. But also, we have excellent partnerships with Maryland Department of Transportation, and we can access, if we need to speak with someone there to help us with executing a plan if needed to create an ability to evacuate, or even to sort of follow up on an issue or a complaint that has come in. Let's see here. I think I might have a few more notes I was going to share with you. And if you have any questions, please definitely send them into Mike, because I think he was going to share some of them with us.
I forgot to announce that if y'all have any questions, go ahead and put them in the chat box.
Okay, here we go. So I will say, regarding this particular disaster, which I do want to share with you, while we were ramping up for the COVID-19 activation, we knew that we needed to be agile to utilize our staff in the most effective manner to ensure that we could sustain our core mission activities. If nothing else, I think COVID-19, this environment, has taught us all that we do need to be agile, and things that were previously considered impossible, such as everyone teleworking, we see it actually does work. It can work. So we are the state coordinating function, leading agency for whole community response and recovery. And we are also a supporting agency for other functions that occur in the state. And so I would say that in this particular disaster, we were very fortunate that we could sort of pivot to deploy staff in a number of ways that perhaps was not part of their core duties, but people really, they upskilled quickly and learned what needed to be addressed. We came up with a framework of who would be responsible for what issues. Because not all of these things are strictly disaster related, but they are certainly derivative impacts that we know will come from that come from just about any disaster. But specifically with this particular disaster, this is a long-term operation, and so we want people to think long-term, not just about this response, but as we move towards recovery. And certainly because we're representing so many Marylanders, thinking about all of the needs that they would have. And this involved not just regular meeting teleconferences with other state entities like PHH and the relay program and technology assistance, but also even at top levels of what type of services that we provide, and also problem solving. As you can imagine, there was definitely many problems to solve with trying to help people that are afraid of exposure, who are afraid of becoming ill, who need access to not just food and supplies, but to their support persons, and to sort of adjust policies to allow for people to have the help they need. So, for example, the hospital policy, the grocery policy, the policies pertaining to other things that that people need access to, that they could call NAN to our constituent services person to get help with. So we're continuing to work every day, and certainly trying to respond to every individual inquiry. We even get inquiries from service providers who need help getting PPE. So it's not just at the individual level. There is some case management that goes on, but also at sort of a bird's eye view at the policy level too. So I'm open to any questions you might have.
Sure. Let me ask a couple, and then we'll see if other people have any. If you do, raise your hand, and we'll recognize you. Cecilia, you've been in the middle of this emergency response for the last 4 months almost. You're coming up on 4 months here pretty soon. What surprises you about it? What's different than you would have thought about ahead of time? Any surprise?
Oh, wow. That's a deep question. Let's see, what surprises me? I think what I've been very pleasantly surprised is how well people have adjusted to working from a distance. We are now into our 16th week, I believe, of not being in our office, and it still surprises me that I can get a response so quickly with my colleagues to solve a problem. I really feel like everyone is doing as much as they can do, and so I've been really pleased with that. And that's just from a state employee perspective. And I think that on the bigger scale is that I've been really pleased with, in my opinion, I think that the state is, that the metrics are showing that, we are really trying to be diligent. The state has a really outstanding team trying to conquer many issues, testing, isolation, contact tracing, things like that. So I think they've put a lot of resources towards that, and shows a lot of leadership. So I guess that would be my, my thought on that.
Yeah. So, sort of an off-the-wall question. Very often during a disaster of some sort, we have, you'll see a news story about ham radio operators and how they're helping out in situations. I happen to be a ham radio operator, but my observation of it over the years has been that amateur radios become less important unless the infrastructure dies. In other words, you probably, or maybe you still do have somebody with amateur radio capabilities posted out at the emergency center. Do you at all?
Well, the amateur radio operators would fall under mass care, which we do have participation there, and the lead for that is Department of Human Services. And actually, we do have amateur radio participate in many of our exercises, and have been used during hurricanes or when other communication systems have gone down. I don't believe that they've been used in this particular disaster, but I know that they're still very active with our particular mass care group, and we welcome their participation. Oftentimes, they even come and do our shelter inspections so that they understand, how we're prepared for various mass care operations.
Sure. Okay, other questions?
Mike, Audrey Sellers has a couple questions. I don't know if she wants to unmute and ask her.
Go ahead, Audrey. I didn't hear him come up in the chat for some reason. Sorry.
Hi, this is Audrey. Thank you. Sorry, it took me a second to unmute. So my first question regards, so I'm from Accessible Resources for Independence. Was doing a lot of different things, and then recently we created a position for me to do like COVID-19 emergency response. So this is right up my alley right now. So my first question is about food delivery. You mentioned a food delivery program that is available through 211 for people with disabilities. If I understood correctly, could you talk a little bit more about that, please?
Sure, I'd be happy to. This program is intended for people who do not have access to private transportation or cannot drive or cannot go to a point of distribution to pick up food. And so with the Department of Human Services and the Salvation Army, we partner together to create this program. And so individuals who need to have food delivered, and this is not like people going to the grocery store for an individual and picking up what they need. This would be food that can accommodate people who have medically restricted diets, individuals who may not be able to prepare food because they lack a kitchen, or perhaps they can prepare it. We basically individualize what the delivery is going to be. And so by calling 211 and making this request, information would be received and then forwarded to a member of the Human Services staff, and then the Salvation Army executes the delivery and does the facilitation to ensure that that person receives appropriate food for, I believe it's for a week, and that can be renewed for additional weeks. And so this will be in effect until the end of October or until the funding is exhausted.
Okay, thank you.
Sure.
And then if they wanted to ask for that, they would call 211 and press the food option?
Oh, no, the person who answers, the operator who answers, the caller can express what it is that they need, and then they will go through some screening questions.
Okay.
Yeah,
and then my
sure.
second question was, so ARI and Image have been working together with MTA for a while. So this might be of interest to Mike too, is what kind of transportation infrastructure is available for people with disabilities in case there's like a natural disaster or something, some other kind of emergency where evacuation has been ordered?
Well, that's a very broad question. So we have, it depends on what part of the state it is. And also, we have two different services in terms of, you have WMATA, and then we have, Maryland Department of Transportation for, the rest of Maryland. And that is something that we would work with the Maryland Department of Transportation or with WMATA to determine what is needed, what could be provided if the resources are there, basically coming up with a plan. So that's not something that we place on a public forum. And then in addition to that, we also depend on our local jurisdictions. And I should make sure this is clear in that when I speak about a state plan, the state plan supplements what local jurisdictions have done. And the local jurisdiction has the authority to make whatever plans that they deem necessary. And then as a state entity, we would come in if we are requested or to help coordinate. And in some cases, for some areas, we could be providing a service in addition to what the local jurisdiction is providing if they can't fulfill that request. So it's very much individualized as far as the transportation options go. And so I always sort of recommend to people to know what services are available in your area, and also, these are things that we would place on, not just on social media, but on our website, to disseminate if there is a plan that needs to be stood up and what that plan would be.
So,
Okay.
so from time to time, this issue comes up, and I'm not sure where it stands right now. Maybe you can help me, Cecilia. There are some fire departments that I know keep lists, if you want to be on the list, for somebody who may need to be transported out, emergency transport, if there's an emergency in their area, disaster of some sort, so that the fire department knows, okay, this person is not going to be able to get out. We're going to have to send in some way to get them out. Is that common practice in fire departments around the state? Is it consistent practice? How does that work?
Well, it is not a consistent practice, and it's probably not even a common practice, although at one time I think it was more commonly used. But as technology has changed, especially with the advent of Next Generation 911, which Maryland is transitioning to, once all the infrastructure is in place, there will be other opportunities for people to self-identify if they need extra assistance. So what we found that with disability communities is often they are reluctant to sort of self-disclose to an entity that they have a disability or they would need extra help. I think there are legitimate fears of, could this information be kept confidential? Could it be hacked?
Yep.
Things like that. So moving away from these registries, if you will, to other forms of requesting assistance that don't require, registries that can be outdated, that require extra staff to maintain. And so the newer, even the iPhones now, you can sort of create a profile within the phone. And there are even apps that allow you to sort of create a personal profile to identify any extra needs that someone might have or accommodations that are needed. And this information can be sent with Next Gen 911, can be provided to the receiving entity. And that way the information remains under control of the user, the person who creates the profile.
Sure.
We're not quite there yet in Maryland with that particular technology, but it is something that the Next Gen 911 Commission has worked on, and it is recognized that it's definitely of value to people with disabilities who wish to maintain their privacy.
Sure. You're very knowledgeable about all this stuff. Tell us just a little bit about how you got involved in emergency preparedness, emergency management.
Oh, thank you. Well, I started off many years ago. I won't tell you how old I am. in the career fire service. I spent almost 20 years there, and so I lost my vision, my eyesight, and so I went back to school and got 2 master's degrees and came back into the workforce. And so, I started doing some teaching, but I always had a desire to get back into disaster management or disaster planning. And so this policy director position came available, which allows me to have a lot of latitude because we do work on many policy issues and provide, advising with respect to this portfolio that I manage, but also there is a lot of case management and hands-on work with respect to response and recovery, which is also, of great interest to me.
Sure. All right. Thank you.
Hey, Mike, we have another question in the chat box from Chiffon, who is asking about when the news channels are doing emergency reports and the accessibility issues when they're saying to look at the scroll on the bottom of the screen. I don't know if Chiffon wants to chip in and expand on that, or...
Yeah, I think the issue she's raising is that sometimes what happens is your local news will have this scroll across the bottom that says flash flood or thunderstorm emergency warnings, etc. And they don't always cut away to give you an audio of that. Have you had any success in dealing with that kind of thing, Cecilia?
It's kind of a constant, it's a constant struggle that we have, the notification and warnings. And so we do advise people to go to multiple sources so that they can find a method in which the information is provided in an accessible manner. I haven't found audio description for weather alerts, but I do find that some versus others, do tend to have better audible description for certain programming. And in this case, I just use a weather radio, and that is what gives me my emergency alerts.
My cell phone gives good emergency alerts these days.
Yeah.
I'm not sure who's in charge of that, but somebody's doing it.
Yeah. So I think that should about wrap it up. I did not know.
One final question, since you're here and you know everything. Would you mind telling us, like, when exactly is this COVID going to be over?
Oh, I can't touch that. I know better. I'm not an expert. I'm only an expert in what I do. I have no idea.
I was looking for a prognosticator. I was getting ready to bet on the stock market and everything, but
I think we need one of those little what were they called, like the magic 8 balls when we were kids, and you would shake it and they would come up with an answer. Maybe we could try that.
Yeah. Well, you don't even want to get me started. I predicted in April that in July this thing would be winding down and that it would be safe for me to go on a big week-long fishing trip to Alaska. And needless to say, I'm not in Alaska and my trip is canceled.
No, you're not.
Don't bet on my efforts to predict anything, but I want to thank you very, very much. You've been excellent, and it's nice of you to come back and give us this update on what's going on so that people throughout the state of Maryland will know, and folks with disabilities will know. We really appreciate it.
Okay, that's great. Well, I hope everyone stays healthy.
Yeah.
I have there's one more follow-up question from Cheryl about the enhanced 911. She asked that is the ability to text 911 was being rolled out county by county, and has it been completed yet?
It has been rolled out county by county. I don't believe it's been completed yet. It has not been indicated to me that it's been completed, but I do have a Next Gen 911 Commission meeting in 2 days. So I'll get an update then.
Okay. Thank you.
No problem. All right, everyone. Thank you so much. Take care.
All right. Thanks very much, Cecilia.
Bye-bye.
Thank everyone else who attended today, and once again offer you the opportunity, if your organization or group would like to make any announcements about service changes or special activities or things going on, this is your opportunity to let the people of Maryland, the folks with disabilities and service providers know what you might have going on. Anybody else with announcements?
I have one thing, and I'm actually not from Maryland. My name is Melissa, and I'm actually on the call from Illinois, but I have a systems advocacy issue that's come up that affects Maryland. So I have family members that live in Maryland, and we've noticed that Walmart has removed all of their benches, which puts undue burden on people with disabilities. My family member contacted me and told me like where she was from, and so I contacted the center in her county, and she kind of directed me to this call. So I personally, as an independent living specialist, have complained to Walmart, but the more voices we get on this, the better.
I think you're right, Melissa. Thanks for bringing it to our attention. This is very interesting. You know, it's that old story. You solve one problem and create another one. I'm sure they took the benches out because they didn't want people sitting next to each other. And in the process, they created a situation where, in fact, people who need to sit can't sit anyplace.
Exactly.
So,
yeah. Exactly what happened.
Cecilia, are you still on? No, I think she had to get off. So I'm sorry, but I thought maybe Cecilia would be a person. Sometimes our state folks can really attack these problems from the management at the top situation with organizations like Walmart. Yeah, we'll get on that. If you want to use the private chat and
I can
send,
look into it.
who's that, Bong?
Yeah.
Bong Delasario. Okay, Bong's going to look into it. So what you ought to do, Melissa, is maybe go to the private chat and shoot Bong a phone number, an email address, or something, and then we'll start working on this. Because yeah, I'm sure somebody thought they were solving a problem and has now created another one.
Yeah, it's a corporate Walmart decision.
Sure.
I've been on it for the last couple of weeks, but then I had a family member say that her mother or something can't go shopping because the benches are gone.
Yeah.
And the benches outside of Walmart are roped off. So
yeah, right.
Yeah.
Yeah. No, I'm sure that's the whole point. They've been trying to solve that problem of not having people all sit next to each other.
Right.
And voila, now nobody can sit anyplace. Oh well.
Right.
Yeah, we'll get on that. So are you with Center for Independent Living in Illinois?
Yes, I actually just took a job right before COVID started as an independent living advocate at a center here in Central Illinois. And so it's been fun to learn the ropes while COVID's going on.
Yeah, you picked an interesting time. I have one other of our employees who just started in January, and I told her, I said, well, it'll never be like this again. So,
Yeah, it's been interesting. I got like 3 days of training and then they're like, okay, work from home. And I've been flying by the seat of my pants ever since. So
yeah, I'm sure that's the way Stephanie feels too. All right. Well, thanks very much for checking in with us. Any other questions, comments, issues anybody wants to raise?
Well, I was just going to say, I can ask Heather to put my email address in the chat. So if she wanted to just email me,
Right.
I can look into that too.
All right. Good.
Do that.
Good.
Thank you, Heather.
Okay. Anyone else?
Hey, Mike, this is Pam from SMCIL.
Hey, Pam.
How are you? If she could tell us which area she's speaking of, that way we can address them each center can address the area for which she's speaking of, or?
Yeah, I'm sure she's probably right that maybe you can try and handle it at a local level, but I'm sure this is a policy decision that Walmart management has come up with. So we've got to figure out a way to get to the management folks at Walmart
yeah,
and I think we ought to be thinking of too is what's the solution, right?
well, I brought up, itemized seating could be an option. And then they came back with, it hasn't been quality checked. And so my other thought to them was, well, then put a sign that says one person only or one person at a time. The thing that I brought up was, they have those motorized carts. Those motorized carts seat only one person at a time. But if you take those away, how many people wouldn't be able to shop? The same is true with these benches. When those carts aren't available, there are many people that walk through the store but need a place to sit down. And many people are not able to shop right now because of that. In fact, I can't believe that I was the first person to notice this. I went to my local Walmart and I have a mobility disability. So I'm in braces with crutches, waiting for public transportation that's 20 minutes late and with nowhere to sit down. And they said, well, we removed them because of COVID. And as we just noted that COVID's not going away. So you've pulled benches that are utilized for shoppers, and when do you plan on bringing them back?
Yeah. Yeah. And it's, I think we're going to have to, I guess, what did they say about single chairs? What's the problem with those?
It basically said that they haven't been quality checked. So apparently they don't have chairs that they can put out that have been, quote, quality checked so that they don't cause injury or something.
Okay.
Can I say something? I went to Walmart, Germantown, Milestone Plaza last week, Saturday, and I did notice that there were no seats anymore. I'm visually impaired. I had to be walking up and down with my cane and leaning up till my transportation came as well. So
yeah, I found a lady sitting on the ground. An older lady was waiting for the bus sitting on the ground, and I was standing there waiting. And I deal with chronic pain, so for me to be standing for long periods of time after walking Walmart, it's just not a good thing.
Yeah.
So, I mean, my family members live in Montgomery County, and the Walmart that they said the benches on the outside have been roped off and the benches inside have been removed. And that was in a Germantown Walmart.
Yes, that's the same one I'm talking. Milestone Plaza. It's in Milestone Plaza.
Okay.
So,
I think what I'm going to do after we get off the phone here, and I'll copy you into it, Bong, is I'm going to feed this information back to Cecilia. It's not quite an emergency management situation, but it is one where she may be able to help us put some state power behind fixing this.
Okay.
But yeah, good points. All right, anything else, folks? No other questions. All right. Well, I want to thank everybody a lot for being here today. It's always a pleasure to be able to get this information out. If you have people that you think should be a host, be a guest on this show, please let us know so that we can get them involved and get them on the schedule. We're currently scheduling for August, so we're finding plenty of people. We're just wanting to make sure that we hit the right folks for you. These don't all have to be about COVID. We have one coming up here in a couple of weeks on recreation in Maryland and activities for recreation in Maryland, because there really needs to be fun sometimes, even though there's a national emergency going on. So we're going to focus on recreation, and we've focused on technology in the past. We're going to do some more of these technology things as well. Also, if you're interested, I would remind everybody that this month are the only national organizations of people with disabilities that are having conventions. So people who are blind have the National Federation of the Blind Convention. It is online this year through Zoom. There is the American Council of the Blind Convention coming up this month. These are organizations of blind people. There is the National Council for Independent Living, NCIL, is having their conference later this month as well. There's just a wealth of knowledge and information you can get. One of the lessons I learned early on in my disability experience was you could learn so much from other people that you didn't have to always reinvent the wheel. So go out and meet other folks with disabilities, and you'll find out that you have a lot more in common with them than you might suspect. And you'll learn a lot. So check out these conventions that are coming up this month. Be a part of them. And it's so much easier this year. You don't have to go to Washington, D.C. or Dallas, Texas, or Utah, or wherever the convention happens to be. You can just sit down in your basement with a glass of water and a sandwich and listen and participate. So please engage in that. We call these programs I Am. Independence Amplified Maryland. We are the voice of the independent living centers in Maryland, and we're pleased to do this. I am also implies that I am competent, I'm capable, I am resourceful, I am a problem solver. As I've said before, disability is just a problem waiting for a solution, and there is one out there. You just have to find it and use it. So thank you all very much. And if there's nothing else, we're going to say goodbye for this week, and we will talk to everyone next Monday at 2 o'clock.
Okay. Thank you. Bye.
Bye now.
See you later.
Mike.